Alright, it is 4:30, and we call this public hearing of the Champaign-Urbana Public Health District to order. Is there any public participation regarding adoption of ordinance 2023-91, the tax levy ordinance payable 2024? Alright, seeing none, I'm going to adjourn the public hearing. Now I call to order the monthly meeting of the Champaign-Urbana Public Health District. Clerk, could you please call the roll?
Kyle Patterson.
Here.
Danielle Chenoweth. Here. Andy Cornston.
All right, can I have an approval of the agenda?
So moved.
Second. All those in favor? Aye, that passes. Now I need a motion for the approval of minutes from previous meetings from August 14th, 2023, the monthly meeting, and August 31st, 2023, public hearing and special meeting.
So moved.
Second. All those in favor?
Aye.
All right, that passes. Public participation. Seeing none. Moving on to correspondence. All right, moving on. We have no old business, so new business. We have a treasurer's report.
Yes, as of July 2023, which is the first month of the new fiscal year, we had cash on hand at $8,586,255. Our total fund balance at the end of July was $9,131,635, representing 50% of the budget expenditures for the year. That's within our guideline, just barely the 25 to 50% of the annual expenditures in cash. At the end of the first month of the fiscal year, we had a surplus of $109,060. That's versus a budgeted year-to-date deficit of $255,050. The annual budget for the year is just over $8.4 million, with an operating deficit budgeted at $2,785,197. Total revenue for the first month was $1,171,828, which is $141,929 under our year-to-date budget, mostly due to contracts, to grants and contracts, which was under the year-to-date budget by over $164,000. Expenditures for the first month were $1,062,768, which is $506,038 under the year-to-date budget, mainly due to personnel at $106,000, benefits at $169,000, contractual services at just under $48,000, and capital outlay at $168,501.
Good question.
Yeah.
I noticed that our balance is a little over $9 million. Do you have a sense of the history of our balance, cash on hand has been?
I mean, I have not tracked it year over year.
Okay.
To this, yeah.
Maybe Mandy, do you have a sense of cash on
I
hand?
don't understand.
We have over $9 million in our end of our fund balance as of September 7th. And I'm just wondering how that compares over time. If we've seen an increase or decrease in our fund balance.
That's an increase.
That's an increase.
Yes.
I mean, if the budget is increasing each year, and so is the percentage, then.
All right, next we have approval of payments to Board of Health appointees. Treasurer Ron Fields for August services in the amount of $649.80. Check request number 7186.
So moved.
Second. All those in favor?
Aye.
Aye, that is approved. Attorney Ruth Wyman for legal services, July 23rd, 2023 through August 14th, 2023 in the amount of $525. Check request number 7139.
So moved.
Second. All those in favor?
Aye.
Aye, that passes. Review of monthly credit card statements. Are there any questions?
No question.
All right, moving on, adoption of ordinance 2023-91, 2023 tax levy ordinance payable 2024.
So moved.
Second. No discussion, all those in favor?
Aye.
Aye, that passes. Approval of interagency agreement between CUPHD and McHenry County Department of Health for fiscal year 24 minority health grant.
So moved.
Second. All those in favor? Aye, that passes. Approval of amendment to Curve Dental's order form and application term of services to add 4 new Curve Grow lines.
So moved.
Second. All those in favor?
Aye.
Aye, that passes. Approval of requisition number 7191, payable to Vasquez Construction Incorporated for wellness and health promotion flooring, furniture, and paint in the total amount of $46,210.
So moved.
Second.
Quick question, was there an RFP for the flooring, or how is Vasquez chosen?
We didn't do an actual RFP on it, but we did ask for quotes from different ones.
Okay, did we use the minority and women
Right.
contracting list?
Yes.
So we didn't. And did this group represent the lowest bid, or what was the criteria?
And doesn't the Vasquez was the lowest.
Is it considered minority or women-owned business?
The minority was still more expensive than Vasquez was, so.
No,
we just-
what Vasquez
we
was
was
it?
the lowest.
Vasquez we went with the lowest bid instead of, but there were minority contractors who
Yeah.
applied. Okay. So I'm just confused because sometimes we're given bids and we're asked to choose between them, and sometimes we're given one bid without any context for the process.
We're
And
trying to
did-
make sure that we already give you who it is at this point.
Yeah, so I guess, and I'm looking to Julie in terms of process, like I'd like to work with for the administrator, work with the equity officer to come up with a process that's really clear about how we go about selecting vendors and what process we use to prioritize. So sometimes we go with cheapest, sometimes we go with quality, sometimes I actually haven't seen us go with minority-owned businesses, or really
I think we
prioritize
only-
that.
Yeah, I think we usually only go with lowest bids,
Yeah, but
as far
it's,
as I know.
That's what we have done.
I mean, that's just kind of how we've always done it.
Okay.
What we did, so we've always just sent out for, as, at least 3 bids.
you know,
But once we started using the list, we started sending it out to the list
Okay.
and then just getting,
yeah. So I would encourage us to look at the county's procurement process, the city of Champaign's procurement process. Both of them have spent a lot of time on this issue, not so much Urbana, unfortunately. I think they could make you learn from these other two, but essentially looking at the procurement process and making some prioritization based on price. Obviously can be very high priority and high points. I wouldn't argue against that, but also looking at local and looking at minority and immigrant, minority-owned businesses and women-owned businesses. And the state of Illinois also does this, and so it isn't always the lowest bidder. I know Andy, if he was here, would also want a prioritization around, like, do they pay prevailing wage, or is it union?
we have to do prevailing wage.
So you have to pay prevailing wage.
No matter who does it,
Okay.
they have to do that, and they have to do what? Give us a certified payroll.
Payroll.
Yeah, so no
Okay.
matter who does it, even,
Yeah.
no matter who does it, that's a must.
Okay.
And they have to show that in the,
Yeah, so it's a when we talk about equity and public health, moving dollars to local businesses, especially those who have been excluded from processes in the past, has a public health implication. So there's a reason, certainly if it's significantly different price, I think it's important to look at that. But I think if the prices are close, I actually think it's a question, it's a matter of debate whether you go with the local bidder, if they're, an out-of-town group, or they, so I guess the way to do it that doesn't seem kind of willy-nilly is to have a point system and have a written procurement process, and that procurement process to build in equity into that picture. So anyway, I mean, I've been talking about this for a while. I've been waiting for an equity officer. We have one hired, and I think it would be really important for that equity officer to look at our procurement process. That policy can then come to the board, and the board can look it over, provide input, and pass it, and then it becomes the policy that all the staff use to screen vendors. We don't just go for one bid, we have to have 3 unless this is a particular specialty where or there is only one provider in the community, right? So there's different criteria for how many bids you get, et cetera, and how you do outreach. So I think public health could do better on the procurement process. So.
All right, moving on, approval of requisition number 7089, payable to Schoenberg and Schoenberg for removal
I
and
think
replacement.
there's quite a process, I just think we still need to.
Oh, you're right. All those in favor? Aye, that passes. Next, we have approval of requisition number 7089, payable to Schoenberg and Schoenberg for removal and replacement of the concrete ramp in the amount of $28,365.
So moved.
Second.
Good question, what was the process for selection of this?
Same as before. I got a hold of CS Construction, I got a hold of these gentlemen, and I got a hold of Central Illinois Concrete, or A1 Concrete. They're all on the list. They came in, did a bid, and these gentlemen, again, were the lowest of them 3 bids.
Okay, and what list you're referring to? Is it
City
the
of
city of
Vendors
Champaign?
list, that's all we've been given.
Okay, and were there minority owned or women owned?
CS Construction was minority owned.
Okay, and it's Schoenberg minority owned?
I don't know that.
Okay.
Was it on the list?
Yes.
Oh, then it was.
Okay.
Everything, that's my understanding, everything on the list from City of Champaign is correct. It's
And
minority or women-owned business.
if you're looking at their particular, their list that is specific, minority women-owned business, they keep a list, as does the state. So, and I sent, somebody asked me this question, maybe it was Mandy, I can't remember, asked me to send you all the links to those. So yeah, the state keeps a list and then Champaign keeps a list. And so I'm happy to hear that we're using that list for outreach, because outreach is like half of the process, is just making sure we're reaching those candidates. That's all I had.
All those in favor?
Aye.
Aye, that passes. Approval of property and casualty insurance renewal and payment in the amount of $37,277, which is an increase of 9%.
So moved.
Second, all those in favor?
Aye.
Aye, that passes. Approval of cyber liability insurance coverage and payment in the amount of $19,827, and this is new coverage.
So moved.
Second.
We need this.
Yeah,
Well,
like the
it's
time.
new coverage after we got the ransomware
Yes, I
attack, and
remember.
then we couldn't get insurance. It's taken Pat
Really?
all
3
this
years?
time.
Oh, because of that incident?
all this time to find somebody that
Wow.
would do it without it being like completely ridiculous.
Oh, good job.
All right, all those in favor?
Aye.
Aye, that passes. Approval of 2023-2024 MOUs for school-based sealant program services between CUPHD and the Regional Office of Education, number 9-rating program, Urbana Unit 116 School District and Champaign Unit 4 School District.
So moved.
Second. All those in favor?
Aye.
That passes. Approval of farm-to-school grant agreements between CUPHD and Urbana School District 116 for agricultural education, turnkey grant activities from July 19th, 2023 to June 30th, 2024, amount not to exceed $34,416. CUPHD and Urbana School District 116 for CU Farm to School Program, activities from July 1, 2023 through June 30th, 2024, amount not to exceed $28,340. A CUPHD and Solagracia Farm for agriculture education turnkey grant activities from July 19th, 2023 through June 30th, 2024, amount not to exceed $3,904.
So moved.
Second. All those in favor?
Aye.
Aye, that passes. We have the approval of sub-award agreements for opioid overdose reversal training activities for the state fiscal year 2024 between CUPHD and Agri County Health Department, CUPHD and Coles County Health Department, CUPHD and DeWitt Hyatt Bi-County Health Department, CUPHD and Douglas County Health Department, CUPHD and Cumberland County Health Department, CUPHD and Clark County Health Department, CUPHD and Ford County Health Department, CUPHD and Vermilion County Health Department.
So moved.
Second. All those in favor?
Aye.
Aye. That passes. 15 pending grant contracts for the administrator to sign.
And there's something, is there a list on the end? There's nothing on the end.
Do you remember something?
There's
No.
no public health emergency preparedness, is that?
Yeah, I think that, look on the very back, I
Back
think
of
there's
this?
something. I thought Amy specifically asked me about one. But yeah, he's got it, okay. That's it.
Okay.
Okay, we have this between CUPHD and IDPH for public health emergency preparedness, build and sustain emergency preparedness capabilities in the amount of $82,809. This is in the administration division. Contract period would be July 1, 2023 through June 30, 2024.
Approval and signature? Or it just says?
This is just informational.
Oh,
Yeah.
this is,
Yeah.
okay.
Our next meeting, we have a special meeting September 21st, 2023 at 4:30 p.m. Potential study session September 28th, 2023 at 10:30 a.m. And a monthly board meeting October 9th, 2023 at 4:30 p.m.
Good question, are we planning to have a special meeting? 'Cause I
Yeah,
think
that's what I was just
I
getting ready
think
to
that
ask.
conflicts with, our, county board meeting or study session. I know I'm supposed to be there for the IGA.
Our meetings don't start quite that early.
It's not 4:30.
Well, no, yeah, it's
Okay, so
usually
that's what,
6:30.
that's what we're talking about, the one where we're talking about legal things.
Oh, okay.
Is it that one?
It says, meetings will be to approve bids provided by Burns Clancy regarding the sidewalk project. That's actually what's in the, that Amy sent. Oops.
For the special meeting.
Yeah, for the special meeting on the 21st. Is there a reason we didn't just do that today?
Because they're, the bidding process ends on September 15th.
Got it. Got it. Okay. Cool.
All right, seeing no other business, I call this meeting adjourned.
And I don't think we need to move it out, is it correct? We do not have to move about the legal thing. Your individual committees,
Yeah, you're, CPHC
go for it.
you're not a party, you're not, the CPHC is not a party in that case. That's what I found out.
It's a different term, and I don't remember what the term is.
I thought maybe we can do a presentation. Do an amicus brief, and we should discuss that. And I think we should, but it yeah. We can ask. That's my understanding.
done? Guess I'm done.
All right, so.
Bruce, do you know the answer to that one?
I'm sorry, what's the question?
Is CUPHD part of the appeal?
I believe so. I actually emailed Joel while I was on my way here, to ask, and I didn't get a response. My guess is.
But that, yeah, that's
I
what
mean,
I've
I know
heard.
it's like, we, even in the thing, we're like a small part of it that has to specifically do with the RANA thing.
Yeah, but I had emailed and told, Joel that CPHD wanted to be part of it.
Okay, so that's what I thought we were pretty much done on this end with it.
Yeah.
Okay.
Is it your understanding that part of it meant filing an amicus brief, or do you think it's more than that?
I don't know, actually, so I'll talk to Joel and ask.
Yeah, because CUPHD is actually not listed in the lawsuit that had the appellate court just ruled on. That is for Julie. I'm not gonna sign that. That is for Kyle, okay. I'll sign Julie.
The September 28th meeting is special study session. Is that something anticipated to really occur in the morning, the 10:30 a.m.?
Not that I know of.
Okay.
Is it? I don't believe so.
I think that's just.
We just stand, it's like a placeholder, we keep it
Okay.
on there and then cancel them
Okay.
if we don't need it.
So how do we go about the list of vendors that we have online for us?
Yeah.
How do we go about getting that more updated, because a lot of them, we look
Yeah,
at,
they don't
they're all
exist.
expired.
They're expired on that.
Yeah, I think it's because they're not, because Champaign may not be regularly updating that piece. So my recommendation, without knowing all the details, is that our equity officer work with our staff to create a procurement policy that comes to the town board. But part of that procurement process is that we can use both the state and the local lists, and then we can have them, we can have a kind of like, through the process, have them send their updated certification to us as part of their RFP response.
Okay.
So we would either ask them to certify with Champaign and then show it, or there are other ways to prove minority and women-owned ownership, right? So I think that just adding